Namaste. Samadosha Samagnischa Samadhatu Malakriya Prasanna Atma Indriya Manaha Swastha iti Abhidhiyate. Ancient healthcare system defines health as a balanced state of body and mind. I, Dr. Sandhya Sadana, Chief Administrative Officer of Srishi College of Ayurvedic Science and Research Hospital, Srishi University, Cuttack, Odisha, takes a pride privilege to express my deep, heartfelt gratitude to all the eminent resource persons, our viewers, support team, for participating in our today's session on integrative approach to health and wellness. It is indeed my honor to have the most dynamic and eminent personalities of all healthcare systems, namely Ayurveda, Yoga, Siddha, Unani, and Allopathy at one forefront to discuss about the collaboration and integration of all these streams for the best healthcare outcome in a holistic way. Our chairman for the session is Professor Dr. B.R. Sharma ji. Professor Dr. B.R. Sharma is presently working as professor and head of the Department of Yogic Science, Dean, Faculty of Health and Wellness in Srishi University, Cuttack. Dr. Sharma is an academician with more than 35 years of experience in field of yoga, education, and research. We have our co-chairperson, Dr. Durga Prasad Das ji. Dr. Durga Prasad Das is currently working as a Dean cum Medical Superintendent at Sri Sri College of Ayurvedic Science and Research Hospital, Sri Sri University. He has over 18 years of experience in Ayurvedic pediatrics and experience of 12 years as a postgraduate teacher in Kumarapritya. We have Dr. Giridhar Gyani ji with us. Dr. Gyani is currently working as Director General, Association of Healthcare Providers, India. Prior to this, Dr. Gyani was Secretary General, Quality Council of India, an apex national body responsible for establishing and operating national accreditation structure and promoting quality in all walks of life. Dr. Gyani is widely known as founder of healthcare quality in India. We have with us Professor Dr. Tanuja Nesari ma'am. Professor Nesari is working as Director as well as Head Division of Translational Research and Biostatic at All India Institute of Ayurveda, Government of India, New Delhi. She is also a chair for Health Sector Sub-Skill Council for Ayush. She has worked as a CEO, National Medicinal Plant Board, Ministry of Ayush, Government of India. We have Dr. Sanjeev Kumar Singh ji with us. Dr. Singh is currently serving as a medical superintendent at Amrita School of Medicine, Kochi. He worked as regional coordinator at WHO. Dr. Sanjeev is also an ambassador from India to Society of Healthcare Epidemiology of America. He's an external consultant to WHO on regulatory, licensing policy issues, and quality interventions in India. We have Dr. Asim Ali ji with us, Dr. Asim Ali Khan ji. Dr. Khan is Director General of Central Council of Research in Unani Medicine, Ministry of Ayush, Government of India. He worked as an associate professor and consultant Unani physician. He was a strategic advisor on establishment of new healthcare educational institutions. He has a work experience of more than 33 years. We have Professor Dr. Meena Kumari ji with us. Dr. Meena Kumari ji has joined as a director of National Institute of Siddha, Chennai. She is an expert in field of Siddha medicine. She is also vice president of Journal of Indian Medicine and has almost 16 years of clinical and teaching experience. We have Dr. Prachi Garodia from US with us. Dr. Prachi is MD in an internal medicine, specialist in White City. She has over 31 years of experience in the medical field. She is board certified in internal, integrative, and lifestyle medicine and also trained in Ayurveda, yoga, and meditation techniques. We have Professor Vaidya Kamlesh Kumar Sharma ji with us. Professor Dr. Kamlesh Sharma is Professor in Department of PG Studies in Swasthavrita, National Institute of Ayurveda, Jaipur, and an Executive Committee member of CCIM. He has been awarded with the prestigious Bhikshuk Shri Award for his contribution to Ayurveda. He has 35 years of teaching experience, clinical and research experience in the field of preventive and promotive health, lifestyle diseases, Ayurvedic diseases, dietetics, yoga, and naturopathy. I am esteemedly honored to have you all on the panel. I invite our chairperson, Dr. Professor B.R. Sharma sir, to lead us forward.
Namaste. Good morning, good afternoon, and good evening to one and all. At the outset, let me thank the World Forum for Ethics in Business for giving us this opportunity to organize a panel discussion on this World Health Day. I, on behalf of Srishi University, would like to extend a warm welcome to all our esteemed panelists, all our viewers, supporters who are virtually connected with us. The theme of this panel is Integrative Approach to Health and Wellness. Integrative healthcare is holistic, it is preventive, takes the whole person into account, and healing-oriented approach wherein patient and doctor are considered to be partner in the healing process, and it makes use of all therapies, whatever is appropriate for the patient. Now, in this age of science and technology, in spite of the various advancements in the field of modern medical science, various non-communicable lifestyle disorders are increasing at an alarming rate, and conventional medicine falls short in managing such disorders. Therefore, the need is to change the focus of medicine, to shift from illness to wellness, from treatment to prevention, and from generalized approach to the individualized one, wherein other systems, approaches, therapies like Ayurveda, yoga, naturopathy, osteopathy, Siddha, Unani, etc. can play important role along with modern allopathic medicine. Medical professionals all over the world are not only aware of this fact, but also aware of the merits of the integrative approach to health. However, there's no enough clarity and consensus about what constitutes integration. Even in National Institute of Health, NIH, USA, dedicated a separate institute to address the issues of contemporary and alternative medicine. However, the regulatory agencies in the USA or UK and even in European countries have banned the sales of herbal medicine in their respective countries, citing safety issues and lack of clinical evidences about efficacy. In recognition of growing the body of evidence about the importance of integrative approach to health, in 2009, the Institute of Medicine, National Institute of Health, USA, organized a summit on integrative medicine and health of the public, wherein more than 100 health professionals they were participated in it. In the summary of the summit is that, I quote, "The disease-driven approach to care has resulted in spiraling costs as well as fragmented health system that is reactive as well as inefficient and impersonal." In spite of such strong words, the US Food and Drug Association and regulatory agencies in Europe have banned sales of such products as therapeutic drugs. So the challenge is how to change this mindset, how to integrate. What should be the principles of integration? The true integration should not be mistaken for a mere cross-part practice or a pluralistic system of medicine. The integrative approach is required at many levels. And the world is in this process of discovering the process and principles. I hope this panel will shed light on these issues, as this panel is transdisciplinary, wherein the stalwarts from allopathy, Ayurveda, Yoga, Siddha, Unani are with us. They are going to present their views on integrative approach to healthcare, and I'm sure their views will bring a new perspective into focus, and that will serve as an inspiration for changing the mindset and the further integration of powerful modes of healing. At this moment, I would like to request all the panelists that we have devoted in the beginning 5 minutes to each panelist, and thereafter there will be a group discussion wherein we have to put the question to each others, and there will be a question answers, and likewise this panel will so we have to maintain the timeline. I thank you very much for all the panelists to accept our invitation, and thank you very much once again. Over to Sandhya.
Okay. Thank you, sir. Thank you for your warm welcome to all. We'll have the speaker's view now. I would invite Dr. Girdhar Gyani-ji to please speak on how to integrate modern medicine with Ayush system.
So should I share the screen?
Sir, you can.
That is okay. Oh, it is not sharing. Okay, no problem. Actually, I will speak just for, because it is not allowing to share. Now you see, let me begin with this one, that why is the need for integration? Let us go by that fundamental. Today, if you see, average patient, healthcare patient, is highly dissatisfied because of various reasons, non-availability of services, what you call availability, accessibility are not available in most part of the thing. On top of it, the affordability has become the major issue now. Then when we are trying to see here that the holistic care, the way it has been defined, and rightly Professor Sharma mentioned to it, that we are looking at a patient for one particular ailment. We are not looking at his whole body, and that is where the patient dissatisfaction is coming up. The Government of India has decided to establish 1.5 lakhs health and wellness centers. This is the one remarkable change which is going to bring in the healthcare delivery of the country. So far, there is a strong resistance from the Allopathic Association, what we call Indian Medical Association, to integrate Ayush with the allopathy. We are, of course, representing AHPI and the 10,000 hospitals in the country. Our considered opinion is, to begin with, we have suggested to the Government of India that when we are setting up health and wellness centers, let us say in one place out of 4 health and wellness centers in the same tehsil, let one health and wellness center be purely Ayush. Somewhere it will be Ayurvedic, somewhere it will be homeopathic, similarly Unani and Siddha. So this is the way one will start. Second is, we are trying to say that let Ayush continue and allopathy continue parallel body with the linkages between the two streams. These linkages also we have defined that at this place, let Ayush consult allopathy and let allopathy consult the Ayush stream. Now those streams, when we go parallelly and there are linkages available, this will generate experience, confidence building, trust between the two. So this is the model which we are trying to promote. On top of it, the government of India has now allocated 30,000 crores for the nutrition. Now, which is also going to promote the use of, rather promote the Ayush, because nutrition is indirectly or directly related to our Ayush stream. So, with these measures, without offending anyone, because otherwise we'll keep on struggling between the two streams. So this is what we have suggested, that out of 4 health and wellness center have one Ayush. Let two go parallelly with the established link, which will be formal links by the way, and then the two associations will keep talking to each other. And because the public today is highly dissatisfied with the present system, we hope that by integrating the two, these concerns of the patient will be addressed amicably. Thank you very much.
Thank you very much, Dr. Girdhar Gyani ji. Thank you very much for your. I now invite Dr. Tanuja Nisari ji, who is the Director, All India Institute of Ayurveda.
Namaskar.
Dr. Tanuja Nisari ji.
Ma'am, request you to highlight about the key role of Ayurveda in prevention and its therapeutic aspects in integrative approach to healthcare. Thank you, ma'am.
Thank you. It's my proud privilege to be a part of this highly accomplished panelist. My pranam, Sri Gurudev ji, and all the organizers, Rajita Kulkarni ji, Dr. Sharma, Sandhya ji, and all namaste to everyone who have joined from across the globe. As it is said, that very rightly said, that Ayurveda, the strength of Ayurveda is in prevention. As it is said that swasthasya swasthya rakshanam aturasya vikara parimoksham. That means preventing and maintaining the health of healthy person, promotion, prevention, and maintenance of the health and prevention of disease is a strength of Ayurveda. And if at all diseases are manifested, complete cure, eradication, Yadi Parimokshanam, is the main objective of this entire knowledge system. And it is more than a health system, it's a knowledge system, because it is a Sukha Hita Hitam Sukham Dukkham Ayus Tasya Hita Hitam. That means it is a knowledge system of healthy and happy life. And I'm really happy to share that today on the World Health Day, my compliments, and I wish health and happiness to everyone across the globe, to everyone from this forum. And I congratulate for organizing this wonderful seminar, because it is in connoissance, it is similar with the theme of World Health Day 21, that's building a fairer, healthier world. And we can say that Ayurveda is the greatest gift from the Indian subcontinent to the entire humanity, because this is how we are trying to develop the health and happiness for all. And it is the concept of one health. When it is a fairer and healthier world, the environment outside me and within myself should have the harmony. And it is not only physical, mental, spiritual, but the social well-being. That's what Ayurveda says, that prasanna atma indriya manaha swastitya vidiyate. So it is a gracious state of mind, soul, and harmony with all the systems, dosha, dhatu. That's what Ayurveda looks into. And for that, the holistic and integrated approach is with the diet, simple lifestyle, thought process, And then dividing the day into 8 is at 24. 8 hours you have to take the complete rest. Sleep, nidra is important. 8 hours your professional life, but the diet, vyayam, udvardhan, and your lifestyle is very important. I'm really happy to share that during last 1 year, during COVID pandemic, the entire Ministry of Ayush and All India Institute of Ayurveda, we could really prevent the millions of the people with the strengths of Ayurveda, where preventive kit of Ayurveda, Ayuraksha, the entire 80,000 Delhi police personnel, and we have distributed 1.5, that is a 100,000 and 50,000 preventive kits to frontline COVID warriors, and with pre and post immunity status, what we have measured, and the drastic reduction in the trend line, drastic reduction in the mortality rate. That's what we could assess with the conventional measure, that there is a strength in Ayurvedic immunomodulatory measures. And very importantly, when we say that care with compassion, our COVID ward, whatever the COVID health center where mild and moderate patients are being treated, there the word is a care with compassion. It says that patients are physically apart, but they are socially connected. They say that it is a home away from home, and they feel familiar in this COVID ward. Why? Because we give them yoga, meditation, recreation, along with good diet, Ayush Kadha, immunomodulatory measures, and there is a strength in integration. We are not deviating a single 1% also from the healthy COVID behavior. What WHO and Health Ministry says is the mask, sanitization, and physical distancing, but each and every bed has an oxygen cylinder. We measure their outcome measure with all conventional, that is immunomodulators, immune markers, cytokine markers, and also coagulation profile, CT, radiology. So what message I would like to say, that the holistic and integrated approach where we integrate ourselves and align our mind, body, and the soul together, and integrate the lifestyle, diet, thought process, and Ayur yoga model. And wherever required, we should have integration with the conventional medicine. Outcome measures are the conventional, but the approach is entire holistic all together along with. I think that's the key of the success, what we have understood. And what I can say, the future of the medicine is either integration, or the future of the medicine is no medicine. So Ayurveda has not a competition, but a complementary role. We complement with the conventional medicine by adding a thought process, positive attitude, by adding a good diet, immunomodulators, and life supporting like exercise, yoga, and lifestyle. Thank you. Namaste. And I wish health and happiness to all.
Thank you very much, madam, for your thoughts. I now request Dr. Sanjeev Singh ji, who is the Chief Medical Superintendent. He is going to talk on medical strategy and integrate all systems of medicine for holistic well-being. Dr. Sanjeev Singh ji.
Thank you, chairpersons, and thank you, Dr. Sandhya, for inviting. Though I am a strong proponent of modern medicine, but somewhere emotionally I am connected to integrated medicine. And whatever I'll speak comes from the experience that Amrita School of Medicine also has nursing, dental, pharmacy, and an Ayurveda college. And we have been running integrative system of medicine for last 2 decades. There is a personal experience also which I would like to share. My wife is a professor of anesthesia and she had a biliary sludge and she was posted for ERCP. And when ERCP was done, they entered from ampulla of Vater, injected the dye and created pancreatitis, which was hemorrhagic and necrotizing, which also had a pericardial pleural effusion and multiple polyps, which was there. And she has lots of adhesions. So all her small and large intestines are all connected and suffers from small intestinal obstruction each day. the only respite which came in other than the opioids which used to take for the pain for additions was from Ayurveda. So the nutshell is there is limitations to modern medicine, but then there is this integrative medicine. We need to be open to the care which the integrative medicines provide. So it is also important to understand that there is a lot of research which is also going on between modern, and we have a hospitalist with us who's from New York, and she has tested giving papaya for dengue. She has tested, it's another ICMR project where amla juice is being given for handling sepsis, and we have some remarkable results. Now, to talk about medical strategies, I think it should be looked at various levels. One would be definitely at a 35,000 feet level, which would be at policy and advocacy. And for that, I would like to really mention that Government of India has done fantastic work. The National Medical Commission 2017, they brought in a bridge course. People like me who are strong proponent of modern medicines have been strongly objecting it. But we know that there is this first contact still in India in the rural world is integrative medicine, and we need to be very, very realistic in our approach. Government of India also, as a policy, came up with, which Dr. Gyani mentioned, Health and Wellness Center. And I think that is, again, a good strategy as a policy. From medical field, what would be nice is to also catch them young, and introduce Ayurveda in undergraduate and postgraduate programs. If we just have a 15-day introductory sensitization lesson, and what Dr. Tanuja so brilliantly just narrated about health and happiness and holistic and comprehensive care, this is what I think we need to understand. Unfortunately, we have been moved by Western medicine, which is very interventional and procedure oriented, which increases the cost of care. And somehow it has been driving subspecialty care. And that's why the family medicine concept is waning off. And this glamour of Western medicine has really caught up, and we are on a wrong footage. So as a policy strategy, I think we are right. Government of India is in the right direction. We need to catch them young. We need to also train people to be able to say that, yes, integrative medicine works. And how do we do that at Amrita? One of our professors in cardiology is an Ayurveda doctor. Then he went on to do his MBBS, MD, and DM, and he heads that panel. So there is a respect which he commands when he brings in all people together, when there is a referral systems which needs to be brought in. And though there are many challenges, because the younger age group people who have come in, they don't just budge in or refer cases, but he has been a strong proponent. We need to reach out to all the medical societies. So if there are good cases like just dengue treatment, just like surviving sepsis campaign and sepsis treatment, we need to reach out to these societies and say, here is where we brought in good results, and we need to be open to this suggestion and to this science. As a strategy, we need to also create champions, just like this cardiologist of ours who practices integrative medicines, and who encourages both mixing of modern, and it is just not mixopathy, it is both evidence-based synthesis of work. So we need to do that. There needs to be also, why integrative medicine is not being so positively looked at is because that kind of data, very strong, robust research, which is double-blind control research program, is missing. I would say it's minimal. It's not completely zero, but it's minimal. And that is where I think there needs to be a joint program. We are doing one of these programs with our School of Ayurveda, Biotechnology, and School of Medicine. And we are working on some of this repurposing of antibiotics, because we know that antimicrobial resistance is a big problem. And that possibly is going to sort of help. Again, a DBT, DST funded program. There needs to be, whenever there is a cancer, in modern medicine, there is a mechanism where they don't just go to medical oncologists, surgical oncologists, or radiation oncologists and get the treatment started. So as a good practice, they come to the tumor board where the pathologists, the imaging services people, they all come together and take that decision, which is judicious and rational. And I think that is what our cardiologist who in an integrative medicine does. So he establishes a tumor board kind of a discussion, wherein the modern medicine people, the Ayurveda, the yoga, the homeopathy people all come together and suggest the best course of treatment for that particular person. I think the tumor board kind of style is going to be very, very helpful. And whenever we initiate, I think where we generally don't have enough power is whenever we initiate such treatment, and we need to celebrate those successes and keep following up on those patients. And if I'm being permitted to use that word, we need to glamorize integrative system of medicine. That is what the glamour is lacking. And once that glamour with science, with data, with adequate research, with collaborative work comes in, I think it would be very, very successful. I really thoroughly enjoyed Dr. Tanuja's piece of work and Dr. Gyani's, and I'm looking forward to hearing more of the stalwarts. Thank you very much.
Thank you, Dr. Sanjeev Singh ji. I now request Dr. Asam Ali Khan ji, who is the Director General, Central Council for Research in Unani Medicine. He is going to talk on current trends of Unani system in day-to-day life, the keynote of Unani in integrative healthcare. Dr. Asam Ali ji.
Greetings and a very good evening from India. It is indeed a matter of great pride for me to be a part of this panel discussion. I understand and I am given to understand that I'm supposed to speak on current trends of Unani medicine or key role of Unani in integrative healthcare. Friends, Unani system of medicine is a very comprehensive system of medicine which meticulously deals with the various states of health and disease. As its name suggests, its origin is from Greece, and after passing through many centuries and passing through many civilizations and countries, geographical regions, it reached India in the 8th century AD. In India, the system has been developed very systematically and very scientifically by Government of India's continuous contribution to the further development of the system. Today, this system has been recognized globally. At international level, we have engaged with many countries. We have established many chairs in different leading universities of the world. Like in South Africa, University of Western Cape and other institutions in Tajikistan and other institutions. We have signed many MOUs with certain health, which are healthcare institutions in different countries. And not only in different countries, but within country, with all the leading scientific institutions, most of the leading scientific institutions, whether this is ICMA or CSIR or leading research institutions like AIMS and others, we have signed many MOUs. Today, our traditional systems of medicine are very relevant globally because of their holistic and comprehensive approach to health. And our government is fully committed to promotion of traditional systems of medicine. I think we all have been discussing and talking about integrative medicine. It's a developing branch of medicine, and that combines the mainstream medical therapies and complementary and alternative medicine therapies for which there is some high quality scientific evidence of safety and effectiveness. Friends, WHO has also proposed one working definition, the focus of which is providing the right care in right place. The integrated service delivery is the organization and management of health services so that people get the care they need, when they need it, in ways they are user-friendly, and achieving the desired results, as well as providing the value for money. Now, the current challenge is to be specific about what integrated services look like in different settings and how integration can contribute to the intended aim of people getting the care they need. We all know that organizational integration happens when there are mergers, contracts, or strategic alliances between different institutions. Whereas the professional integration happens when different health professions or specialties work together to provide joined up services. The integrated service delivery is best seen as a continuum, and that it involves technical discussions about the various tasks that need to be performed in order to provide a population with good quality health services. What I understand is that while this is the high time probably that we need to integrate in an effort to provide the best solutions to the society, particularly the ailing part of the society, we all have our strengths. I think the best part for us is to first to understand each other better. We need to know each other better. Who are we? What are our strengths? What are our weaknesses? And how best, while respecting each other's individuality, we can come together to provide the best to the society. We all know, for example, in Ayush, I know the strengths of Unani, strengths of Ayurveda. And because of these reasons, and strengths of allopathic also, we know. In many other things, allopathic medicine or conventional medicine is doing wonderful jobs. Similarly, in Ayush systems of medicine, whether it's Ayurveda, Siddha, Unani, homeopathy, yoga, they are doing wonderful things and benefiting millions of patients, not only within the country, India, but outside as well. The Central Council for Research in Unani Medicine, which I am privileged to coordinate the activities as the Director General of this organization, we are doing a lot of activities in CCRUM under the Ministry of Ayush, Government of India. For example, in the clinical or preclinical levels, we have examples of integration of Unani medical centers. We have established many centers in the tertiary care allopathic hospitals in Delhi. For example, one hospital, the leading hospital of government is Safdarjung Hospital, which is a wonderful example where all the systems of Ayush, along with the allopathic system, are working together under one roof. We see the patients, we consult each other, and we try to reach the best possible solution. Similarly, in Deen Dayal Upadhyay Hospital or Rama Manohar Hospital, we are doing it. And we are not doing it with allopathic hospitals only. We are also trying to understand what best is within Ayush. And we are also trying to integrate within Ayush as an intra-Ayush integration. At Rashtrapati Bhavan, the President Estate in Delhi, we have established one Ayush Wellness Center, Health and Wellness Center, where all Ayush branches are working under one roof and providing the benefits to the people. Similarly, at All Institute of Ayurveda, where our colleague Dr. Tanuja Nesri was speaking from, in that institution also we are working together to find out the best solutions to the people. Other than that, we are also signed MOUs with many leading organizations like in AIMS or Jamia Hamdard or Jawaharlal Nehru University or Vallabhbhai Patel Chess institutions or some institutions of ICMR or CSIR we have signed agreements with. And we are trying to do the science in the disorders, trying to find out the hidden potentials of Unani system of medicine, if I talk in particular about. We have many projects, many research projects, whether they are preclinical or clinical, and we have a team of interdisciplinary scientists in different institutions in the country, of our campuses. I have almost 22 campuses in the country, wherein different researches like toxicity studies or preclinical studies or clinical studies are going on. They are going on within house also by the team of the experts of different specialties, whether they are pharmacognosists or biologists or botanists or chemistry people or pharmacology people or Unani people. Similarly, we also go out and reach out to the people in different institutions where we are doing the integrative researches with them. Same is happening not only clinical, but also preclinical level and drug standardizations also. There is one important model we call this National Program for Control of Diabetes, Cardiovascular Disorders, Cancer. We call it NPCDCS. With the collaboration of Director General of Health Services, Government of India, Ministry of Ayush has designed many such projects. CCRUM has also adopted one district that is called as Lakhimpur Kheri. It is in Uttar Pradesh. It is a state of our country. where through primary health centers and community health centers and district hospitals, our doctors of integrated team consisting of yoga specialists, Unani specialists, allopathic doctors, we screen the patients, we examine the patients, we try to understand what disorders they have, and depending on their likings, we offer them the treatment, Unani or allopathic. The people who are taking allopathic treatment, we also provide them the Unani treatment up to some extent. And later on, or we give them the regimental therapies, yoga therapies. And we try to understand after some time that what is the impact of this integration. With this understanding, we are trying to control these lifestyle disorders and trying to manage and provide the benefits to the patients. By now, almost more than 5 lakh patients we have enrolled in such kind of studies. So at many levels, we are doing the integration, and successfully they are doing. In the same cases of the COVID-19, in the containment zones, CCRUM, like other councils of the Ministry of Ayush, have conducted many studies on population-based studies in the containment zones. We are also doing in allopathic hospitals, the COVID management declared hospitals by Government of India. We are doing certain add-on therapies with the available standard treatments of the allopathic, whatever they are trying to manage with the COVID-19 patients, the mild to moderate patients, the positive patients. We have designed certain studies in these particular centers. One such study is already going on with Sutherland Hospital. With these population-based studies or these adjuvant therapies, we are getting very encouraging results that how to manage and how to reduce the severity or the progression of such disorders. So many such activities, not only presently we are doing, we are not claiming through this that we are curing something or that matter, but we are trying to contain and trying to reduce, trying to pace down the progress or the severity of the disorders. So many such activities are going on. I understand.
Sir, I would like to take a pause here. Sir, I would like to take a pause here. We shall discuss further about Unani in our panel discussion, sir.
Sure.
If you allow us. Thank you so much.
There are many things which are happening, and probably this is the high time that probably we need to integrate. Thank you very much.
Yes. Thank you.
Thank you very much.
I would like to welcome our President, Madam, President Srishi University, President World Forum for Ethics in Business, Mrs. Rajita Kulkarni-ji. Thank you, ma'am, for joining our session. And over to you, ma'am.
No, thank you. I was very keen. It is wonderful that all of you experts have joined us, and we had a really fantastic inaugural panel, and the whole world is watching all of us right now. So thank you for your time, and really inspiring to hear your ideas. And I think it is my wish that we continue this conversation and consider this as a beginning of this conversation, and continue this over the time to come and the months to come, and look forward to our integration and towards a more integrative healthcare approach for the well-being of all. So really thank you for your contribution. I just, Dr. Sandhya, Dr. Sharma, I'm here to learn and listen. Thank you.
Thank you, ma'am. I would request Chairperson of the panel to take it forward.
Thank you very much, madam, for your gracious presence. I now request Dr. Meena Kumari ji, Director, National Institute of Siddha, and she is going to talk on Siddha system of medicine in preventive healthcare and key role of Siddha in integrative approach.
Namaste to everyone, and I am very glad to have you all in this very prestigious forum, and thank you so much for giving me this opportunity to explore our system into the for the people gathering here and across the world. And as everyone told, the integrative system, it means this is the time to integrate our traditional system into allopathy for the benefit of population living in India, not only in India, but also across the globe. This is the best time to integrate, because COVID taught us a very big lesson, because this enables us to show our strength to the world. People around the world asking how India fight against COVID in such a way. Ayush took a very great measure, because we all know our Ministry of Ayush took a very strange decision to include all the population into Ayush streams. Very first step that Ayush taken was introduce each and every home remedies to the people and ask about what they are following in their home for prevention of COVID. Because simple COVID remedies have practiced within their home was effective against COVID. It was found very satisfactorily noted among throughout Tamil Nadu. And we also take a very great step to introduce simple household remedies to the COVID. So people encouragingly taken all the procedures and follow all the procedures taught by us by their own. It shows it prevents COVID in the containment zone, even in the red zone. And after that, they practice to take all the home traditional practices like ginger tea, lemon juice, amla juice, and karpuravalli juice, and neem and turmeric, etc. These simple measures are knowingly or unknowingly followed by all the people across the Tamil Nadu and even beyond our borders. We have sent our KADA, that is called Kabasura Kudineer, was introduced for COVID prevention as well as therapeutic measure. We have NIS in special. We have classified the COVID into 4 stages as mild, moderate, and severe. And we concentrate all the 4 stages of COVID as a preventive and mild, asymptomatic and moderate cases, and even severe cases. We have treated all the severe cases into extremely patients admitted at ICUs in Chengalpattu Medical College and SRM Medical College hospitals. There we have integrated our Siddha system of medicine with allopathic standard care, and we found that mortality was very much low in our integrated approach. That is, to some patients, we have administered at Chengalpattu Medical College, we have taken 200 patients, 200 severe COVID patients, and at SRM, we have treated 150 patients. All the patients are symptomatic and admitted at Medical College, moderate and ICU wards. We have noted the oxygen saturation ratio when the patient below 60 after administering our Siddha drug, and the oxygen saturation ratio gradually gained up to 94 and 96, 98 within 3 days, 4 days, like so on. So this is some small example for the best outcome from the integration of Siddha system into allopathy. And we have, like Asim ji told, we have some limitations in all the systems, allopathy, Siddha, everyone have some limitations. But we have to watch our strength, which our strength, area of strength can be applied to the beneficiary as per their need. When someone needs the allopathic care, we can adapt that patient to the allopathic system, and which disease we can treat very strongly and confidently, we can take that patients also. For some diseases, we have to integrate our system with allopathy. As Sanjeev ji said, we are lacking in evidences and evidence-based documents, and we have to focus our strength into the documentation as per the scientific protocols. And I want to explore some other examples here also. Before 5 years, we have exposed to Chikungunya, a new emerging disease at the time, and we have introduced Nilavemba at the beginning for Chikungunya. It was very much effective against Chikungunya, and lots of research were gone for Chikungunya. It was tested by various research methods, and it found proved against Chikungunya. Like dengue also, we have treated with papaya juice with Nilavembu Kudineer, and it was also Nilavembu is when we understand Nilavembu becomes a broad spectrum preventive drug for any viral disease. Initially we have suggested Nilavembu Kudineer, Vishajura Kudineer, and Kabasura Kudineer for prevention of SARS-CoV-19. So we have answers with our strong drugs for any newly emerging diseases, even also for chronic diseases like lifestyle disorders like diabetic mellitus, cancers, and bronchial asthma, or CAD, cardiovascular diseases, and some renal diseases, skin diseases. We have answers with our traditional systems. We have one of our strength is our very rich formulations, which are made up of minerals and metals. This is to some extent is a strength, and to some extent is a weakness. I can say like that, because we are lacking in some efficacy or safety measures for these drugs. We have to focus on this area. If we prove these drugs for safety, we can adapt these medicines, because in Siddha we have there is a text called Agathir Yogi Vaidya Sindhamani. There are 4,448 diseases in total. We can adapt any disease into this classification. We can assess the disease as per their vital signs like Vada, Pitta, Kapha itself. We can choose the drug as per their basic vital forces. So we can diagnose the disease by this classification. So there is no question about there is no medicine for Siddha, or no medicine for any disease in Siddha or in traditional system. We can focus, we have to focus in a scientific way, and we have to pay attention through this scientific protocols, which should be made for our in a traditional system. This is the simple suggestion for the panel, and like Srishi University, and I wish to convey my gratitude to the Srishi University and the organizers and Guruji also, because they are paying attention to the people for a wholesome effect, lifestyle modification in the humankind, because we are lacking only focusing on our career and earning money and everything, but we are lacking for inner onward travel towards in our core system. So we have to focus externally and also internally. I wish you can also understand my view, and this is the time to focus both internally and externally. We have to focus our strength and the conscious awareness and everything to modify the efficacy of the human possibilities. And human motives. We have some motives in our life, so we have to concentrate on this way. And thank you very much for giving me this opportunity, and thank you so much.
Thank you very much, madam. Thank you very much, Dr. Meena Kumari ji. I now request Dr. Prachi ji, who is going to talk on preventive and curative effect of integrative health medicine in lifestyle disorders. Dr. Prachi ji.
Namaskar, and thank you. I'm so grateful for being here. And I've been hearing all of my lovely and esteemed colleagues and their valuable viewpoints and experiences, and really learning from them. As a lot of the co-speakers have already covered, lifestyle-based diseases, chronic diseases, they constitute around 70 to 90% of the burden on healthcare. And it's a very big burden, not just in the terms of cost. In the cost term, like America is paying around 90% of the $3.8 trillion for chronic diseases and mental health, but also for the quality of life, disability, which is causes, to human population, and also to healthcare workers' burnout, including physicians, nurses. There's so much of damage, and as a reverberating, a ripple effect, there's so much of damage being done with the present status of healthcare. So there's definitely a big need to shift it dramatically if we haven't started looking at it. And today this discussion has really helped open a lot of minds and focus on where we need to make the shift. So in the way of chronic diseases, around 80% of older adults have at least one chronic disease. And around 60 to 80% of primary care doctor visits are related to stress. Yet only 3% of those patients actually receive stress management tools and skill sets or any help. So that's a tragedy. I mean, whatever is pushing our diseases, we are really not paying attention to it. And we're just focusing on Band-Aid and temporary patchwork as healthcare, more like illness care rather than wellness care. So let's talk more about what we can do. And a lot of the speakers have already addressed that. But I feel that self-management programs with teaching and educating people how to take better care of themselves, and also educating the doctors, both from the grassroots levels, the doctors should be inspired to learn more about how to better manage lifestyle-based disorders. And for that, they have to learn some of the basic science, which are pulling this bio, mind, physiological, social being together. So there has been a lot of studies done. There is a chronic disease self-management program running in the US since 2006 by the National Council of Aging. And they did a national study in 2013, which showed that they were using like 5 or 6 indicators, including tiredness, shortness of breath, depression, pain, stress, and sleep issues. And the quality of life and all of these 6 indicators improved when the patients were taught how to self-manage their problems. And, they were provided the skill sets. So the patients really were engaged and empowered, to take care of their own health. So it was really patient-driven and not just, okay, take this pill and be done with it. So bringing that responsibility from every person's side is very important for true benefit of integrative health. Otherwise, it becomes more of a burden. Then there's lack of access. You really need to just continue doing this pill or this herbal treatment. So it'll be more like a one-way direction. So unless we ignite that desire to heal ourselves in everybody, that's really, really important and crucial. So talking about the self-management program, that involves a lot of education, engaging, and then teaching the skill sets to the population and teaching the skill sets to the providers, the healthcare providers too. So I would highly encourage people to learn themselves and the government to actually start co-educating for allopathic schools and colleges, medical colleges. There should be more like a 3 months rotation in different kind of integrative modalities, just to have a nice experience. They should also undergo things like yoga, meditation skills, which they can practice themselves, because burnout is a big problem. There's so much of burden on doctors right now that a lot of them are just leaving their jobs, they're getting depressed, they're committing suicide, especially in the Western world, because what we are seeing around us really doesn't align with what we were here to do, to serve that purpose of healing. So I'll just bring you an example of a couple of studies which have been done. They're excellent statistics from meta-analysis and other studies about the benefit of lifestyle changes which have created reversal and prevention of disease. So for example, the 2018 Harvard study, it studied 5 healthy habits, and people who followed that consistently for several years, these were long years follow-up studies, 34 years for nurses health study and 27 years for health professional follow-up study. They actually added 14 years of life to their, good quality life to the life. So real life to their health. And then men added around 12 years of life back to their health. All of these doctors and nurses, they were also 82% less likely to die from cardiovascular disease. There have been several other studies, a systematic review and
the location for meta-analysis. Because of this, time is up. If you can wind up in next 1 minute, you can go ahead.
Okay. So so I just wanted to encourage everybody to take charge of their health, educate everybody around us, and then, just continue the good work of integrating the alternative, traditional, local, indigenous, science-based, and proven practices. Thank you so much.
Thank you.
Thank you, Dr. Prachi for this excellent presentation. I now request Dr. Kamlesh Sharma ji, who is the head of the Department of Swasthvrit, National Institute of Jaipur. Dr. Kamlesh ji is going to talk on the role of Swasthvrit in integrative approach, a key takeaway from Swasthvrit and Ayurveda for prevention of lifestyle disorders. Dr. Kamlesh.
यज्जाग्रतो दूरमुदयति दैवं तदु सुप्तस्य तथैवेति दूरंगमं ज्योतिषां ज्योतिरेकं तन्मे मनः शिव संकल्पमस्तु. Really, I'm very thankful and a great privilege and pride to be part of this panel group. Respected Chairperson Rajita ji, Chairperson of that session, this session, B.R. Sharma ji, Dwarkadas ji, Dr. Girdhar Gyani ji, Dr. Tanuja Madam, Dr. Sanjeev ji, Asim Ali ji, Meena Kumari ji, Prachi Garodia Madam, Sandhya Sadana ji. Now we are discussing about integration. So, first of all, we must learn that, we must remember that every pathy has their own strength, but every pathy has their limitations. So in India, there is a story, and this called and Pangwand Nyay. अंधा और लंगड़ा की कहानी हमने पढ़ी होगी. The blind and disabled person, when joined, get together, then what they can do. So in that era, we have remembered and we have established that. One example I want to put in this great audience. In the first wave of the corona pandemic, And that was the peak time of the corona, I think that date of the November 2020. So one data I want to quote here, a country leading the world economically, that is America, the very best infrastructure in the world, very resourceful medical services in the America. Despite that, out of 10 lakhs population, 672 deaths occurred due to corona in America. That was the data of the November 2020. In the very same time, in India, due to this wave of the first wave of the corona pandemic, out of 10 lakhs, only 72 deaths occurs in India. The conditions are more different. Resources of the medical facilities, population density, education, sanitation, these points are vary in America and in India, but the human casualty due to pandemic of the corona, America get 6,072 deaths, India only 72 deaths. I think this credit goes to every Indian practice Indian system of medicine. Ancestors are using Indian system of medicine, their khan-pan, their diet, and the sleeping patterns in every life, in every part of their life. They are using Indian system of medicine. So they are genetic engineering also happens that resultant that out of 10 lakhs, only 72 deaths occur due to corona pandemic in India. So I think we have remember that. So every pathy has limit and every pathy has their strength. Every pathy is important. Pathy is important, but sympathy is more important to the patient. So when we think about sympathy about concern of the patient or in the human being, or I think in the living concern only, because when we chant every day, Sarve Santu Niramaya, it means not only human beings. We think about individual, means Srishti, Parmeshti, Srishti, Vyasti. So from Vyasti to Samasti, from individual to whole universe, in the every living particle of this universe, she get the Sarve Santu Niramaya. So this is not only the chanting mantra only. So integration of the Sattva, Atma, Sharir, the body, when we think about only mind, we think about only Atma, we think about only Sharir, it is not complete. So integration of the Sattva means mind, Atma means soul, Sharir. So integration of that. Likewise, integration of the diet, integration of the sleeping pattern, integration of the brahmacharya. Likewise, integration of the Vishak Dravyani Upasthata Rogi. There are 4 parts of the treatment. Vishak means the physician, other one is medicine, third one is nursing staff, and fourth one is diseased person. So integration of all these parts of the treatment. So different pathies has their own strength. In the interest of the patient, we have to take in this panel discussion. One thing more I want to put here: 5,000 years back, when Charak narrated the pandemic situations, so prevention for that pandemic situation before 5,000 years back, he mentioned that Satyam. Every science are guiding us that in behavioral, in our talking, we have to be truthful. Then Satya Bhuta Daya. This is the most example in this pandemic. Every person, kindness to every living particle. Third one is Dhanam. When what I am earning, some part of that we have to for the kind of the human beings we have to give. Last word is miraculous. He told us Gupti Atmane, means self-quarantine. I surprised that before 5,000 back, Charak narrated Atma Gupti means self-quarantine. In that period, Charak also mentioned. So these are factors. So we have to prevent to human beings. We can divide in the 2 parts of the whole universe. One is healthy, another one is ill. So the primary object of the Ayurveda is swasthasya swasthya rakshanam. So the two part of the universe, the first part is the healthy persons. They have to maintain their own health due to swasthya vrata. So swasthya vrata, likewise, diet, what should he, what to eat, how to eat, how much to eat, and likewise diet like the sleeping pattern. So these are factors, and Sadvrat is also the ethics. This is the forum for the ethics and the business. So when we learn, when we read in the ethical chapters in the Ayurvedic text, then we learn that this is the Dharma Shastra, this is a Niti Shastra, this is a Samaj Shastra, social science. So when we read that, the Ayurveda is a holistic approach of the society. So first of all, we have to integrate, number one, our experiences, that is Anubhav. Number two, our literature. Number three, our contemporary science. So science, literature, and experience. We have to integrate both three parts of the experience, literature, and third one is contemporary science. Then when we think about that, we can serve humanity better. And when we chant the Sarve Santu Niramaya, I think this cause and this object we can achieve after that integration. So this is not time to share more and more references of the Swasthya Vrata to maintain our health, but this is time to integrate the first part of the Ayurveda, first prime object of the Ayurveda, that is prevention of the disease, Sattva, Sharira, Atma. These three parts of the life, they have maintained their own health. This is our wealth of the universe. So I think in this time limitation, I can share these my views to all the audience, and I am very thankful for giving me opportunity, Dr. Sandhya ji, Dr. Sharma ji. Thank you very much.
Thank you very much, Kamlesh ji. Thank you very much for your precious thoughts. Actually, I have to attend the other session because I'm a speaker in that session. And I think that now the time for discussion, that time can be skipped, if there is any question, we can ask the question between each other for 5 minutes, we can discuss. And I think that I will request Dr. Durga ji to conclude on my behalf. If time given to me just now, I can conclude, but I think that question answer must be taken. Sandhya, is there any question answer, please? Question? Can you take up the question?
I would request the question from the panelists to each other. I would request Sanjeev, sir, if you have some question to be asked from any of our panelists, sir.
Thank you, Dr. Sandhya. I just wanted to ask the group, what would they, because they are talking about integrative medicine, how would they like to work with the modern medicine team so that it becomes integrative? So what would be the step 1 or step 2, just the first 2 priorities?
Tanuja ma'am, will you take it up, please?
Thank you. Actually, it is a complementary, and the integration, what I would suggest, as Niti Aayog is also finding out the integrated health system, and we are working on developing the protocol. So what is strongly recommended is the integration is not the pathy-based. Like integration is allopathy with Ayush system or any other. Integration is a patient-centric. So what is the need of the patient? So if all the strength of all the pathies come together in the best interest of the patient, I think that's the integration what we really feel. And each pathy has a strength, like non-communicable diseases. If someone is a diabetes and taking some oral hypoglycemic agents, metformin, for example, then You can integrate with the other, we can integrate with the diet, lifestyle, yoga, and also when there are limitation of the other becomes the strength of the one pathy. So we have to complement and find out the gaps, so we can complement and bridge.
I think it's trapped there. I have another question, so we will take it up as Dhananjay will rejoin. I have another question from the viewers. In which platform?
Protocol. Yes.
Ma'am, you are on mute. Ma'am, you are on mute.
Oh, I'm so sorry. I was just thought, I'm so sorry. So I was just one line I can say, the integration should be patient-centric. It is not the pathy-centric, but patient-centric. So then considering the need of the patient, all the strength of every pathy can be integrated together. The COVID is the best example where even though conventional medicine is taken, but the immunomodulators from the Ayush system, diet, lifestyle, physical measures like gargling and other measures from many others, and yoga, adding yoga for mental, spiritual components. I think that becomes the holistic integrated model. And that is the way how the patient-centric integration should come forward, and the strength of each system needs to be integrated. In the conventional medicine also, where in the emergency management, the conventional medicine, in the acute condition, conventional medicine followed by long-term management, you can add the Ayush system. Even the non-communicable disease is a strength, but in communicable diseases also, the other measures for mental, spiritual, and also for the immunomodulator, Ayush can be integrated. That's what we have established the successful stories, case studies, and in the diagnostics, whatever we do as a holistic, but the outcome measure to convince, to understand oneself, maybe even though it is our internal outcome measure, but the outcome measure diagnostics can be from the conventional medicine, where even we can do our own treatment. That's way forward for the integration.
Thank you, ma'am. There's one question from our viewers. In which platform all systems of medicine will study about the upcoming health issues and exchange of knowledge will take place? Anyone can take it up. Dekar sir?
May I come in, Dr. Sandhya?
Yes, please.
See, it's very important discussion which is going on, and what Dr. Tanuja has just said, very rightly she said that probably this is the high time now we shall integrate. Now the question is, integration in what? It means different to different people. I gave an example of one district in Uttar Pradesh, one of my states in our country, Lakhimpur, where I have taken up, as CCRE, Ministry of Ayush, taken up for the non-communicable diseases, how we together can integrate. For example, in one particular center, we are providing them the treatment of allopathic system of medicine. We are also giving them the guidelines of Unani system of medicine, whether this is diet therapy or whether this is regimental therapy or this is other things. We are also providing them the yoga therapies. And we have found out that these things are giving wonderful results. Similarly, one more thing is there, that the basic sciences people, when they do the researches in the allopathic system of medicine, I think this is also high time, and nobody has stopped them, that they can also explore the hidden potentials of the plants. They can work on them, and many studies are already going on. Like in preclinical researches, a lot of sciences are being applied on herbs, and we are finding very good results. Similarly, we can also integrate in level of education. Probably at the school level education, probably we need to understand each other. We need to give the subjects of Unani system of medicine, Ayurveda system of medicine, other systems, allopathic to the school level education. And when we graduate, for example, in different medical systems, each system person should be studying what is allopathic, person should study what are the Ayush systems of medicine, and Ayush systems of medicine people also should study the allopathic system of medicine. I think first we need to learn each other better. We need to understand each other's strengths and weaknesses. One more thing is we need to respect each other. And we have many successful models in our Ayush centers in India, where one particular integration in different fields is happening. And as very rightly said by Dr. Nurul, that it should be patient-centric. It is not something to undermine or other way for any particular pathy. It is what I am good at. I be given an opportunity to provide the facility to the patient. What you are good in, you should provide the facility for the patient. I think this shall be the way how we can move forward through education, through different platforms, through researches, and different levels of preclinical, clinical, or different aspects of sciences. I think this is the high time probably we shall move forward in this direction.
Thank you, sir. I invite Dr. Durga Prasad Dasi to take it forward now.
My regards to the esteemed panelist of today's nice seminar on the discussion of integrative approach to health and wellness. It's my pride privilege to be a part of this discussion. Actually, the subject matter is very significant, that integrative approach of health and wellness. As everybody knows, during the division of science, many schools of thoughts developed, like Ayurveda, homeopathy, allopathy, naturopathy, and many things. But when we are giving emphasis to the Charak Samhita, all science have their own thoughts, but 6 are the common things. That is Vidya, Vitarka, Vijnanam, Smruti, Tat Paratakriya, Yat Shate Shad Gunastasya Nasadhyam Ativartate. So here, the Vidya is the conceptual knowledge of the science, then arguments, science of the way of understanding, then memory, and the punctuality with the practical procedures are very essential to understand about the science. Ayurveda science develops with 2 important concepts, that is Swasthasya Urjaskara, that is prevention and protection of health of healthy individuals, and second one is Aturasya Roganut, that is management of ailments. Here, Ayurveda science gives emphasis for the Rasayan therapy, that is rejuvenation, Vajikaran aphrodisiac, Achar Rasan, moral behavior, which is much more emphasized in Bhagavad Gita, then daily regimen and seasonal regimen, and steps to be taken for prevention of Janapada Dhvansa, that is destruction of the human society. When we are considering the integration, 2 things comes to our brain. One is Aturasya Roganut, how it will be taking place. One is allopathy system of medicine, where emergency management, infective condition management, surgery, and acute condition management is important. In Ayurveda system of medicine, chronic diseases, lifestyle disorders, where Tanuja Madam already explained, sometimes we may not be able to prescribe drugs to individuals. No drug may be essential. So the way of understanding from the Dravyaguna point of view, the drug action takes place, which is described in Ayurveda through its influence, property, potency, biotransformation, and unseen perceptive drug actions, which is Prabhav. So here, point of integration is establishment of the above facts through mechanical measurements. Sometimes people have a false belief or pseudo belief that cross path is dangerous, but the reality is different. Cross path, it is not cross pathy. When you are advocating Ayurveda with allopathy or something which is essential for the recipient, one should go for practice. Already, Dr. Sanjeev Singh described nicely about with the example of the cardiologist, that how it is beneficial for the human society. And also Professor R. Meena described the same things. Here, for the point of integration, three things are much more important. One is enthusiasm or inquisitiveness to work, that is healthy mind. Second one is enlightening different situations by observation, that is humbleness. And third one is perception to alleviate distress of individuals, that is compassion. The objective of integration is not for the sake of earning money, it is for doing justice to the human society, which is very essential. I want to focus on about the surrogate evidence of the integral approach. The reality is, in a high blood pressure, the surrogate evidence may be due to heart attack. Later it may be heart attack, but the major reason is cholesterol. Similarly, if we'll give opioids to a person regularly, if a king cobra bite will be there, that cobra will die, not the person, which is on the observational study. Similarly, if we advocate some of the herbo-mineral preparations or herbal preparations, we can able to protect the life of the individual through COVID-19. So now the time is more. I can request Professor Sharma sir to end with his concluding remarks.
Thank you, Dr. Durga Prasad ji. Thank you very much.
Sir, you're on mute.
I, on behalf of Srishi University, would like
Sharma sir, you are on mute. You are mute, please.
Thank you very much, Dr. Durga Prasad ji. I would like to extend a profound gratitude on behalf of Srishi University to all the esteemed panelists. The thoughts, the pearls of wisdom they have shared with us. The first of all, Dr. Girdhar Gyani ji, who has given the reasoning why to integrate. Because the time is, another panel is waiting for this, and therefore I have to be short. Dr. Tanuja ji has given the objective of Ayurveda, and beautifully she said our approach should be patient-centric and not pathy-centric. Dr. Sanjeev ji has given emphasis, and which is very, very important. It needs data, it needs research, minimal research, at least it take it, and the policy advocacy that is also required. And some of the every pathy, as it is beautifully said, that every pathy has its own limitations, but also the strengths. So strength part can be taken into consideration for this integration. Dr. Asim Ali Khan ji has discussed about the Unani aspect, and he has also emphasized that let us respect each other and how we can integrate the principles of each other with respectfully, so that two things he has made very clearly, that it should be, our approach should be at the right care and right place. That is the most important. That is what I could take up from his. Dr. Meena Kumari ji has mentioned about the COVID and how they were implementing the different herbal medicines during that time. And also, she has also discussed about the Chikungunya and also the dengue, wherein she has mentioned about the Kavasur Kudnir and other medicines for the dengue, particularly the papaya and other things. So she has also mentioned that our strength should be integrated. That is the most important. Dr. Prachi ji has beautifully mentioned that there is a need for the self-management. Their self-management should be, program should be organized. Educating the doctors how to manage the lifestyle disorder is a very, very important. And as in our Ayush ministry also, the CME program is taken care of. I would like to inform Prachi ji that this kind of activity is taken care of by the Ayush ministry in India. A patient-driven approach should be there. That is what she said. And teaching the skills, and also this, she has also talked about the yoga and meditation and other things also. Dr. Kamlesh ji has beautifully said that there are many pathies, but if there's no sympathy, no use of any pathy. So at least this sympathy should also be integrated in all the aspects. With these words, thank you very much once again to the panel. Dr. Durgaji has presented his views regarding the traditional method of integrating. So that is very, very important also. It will be taken care of in the further discussions. And thank you very much once again to each and every panelist for their precious time they have given to us. And this will be continued, this kind of activities, and I would request the same support from their end. Thank you very much. Thanks once again. Thank you.
Thank you so much. Thank you to everyone.
सभी को नमस्कार, धन्यवाद.
Namaskar. Thank you, everyone.
We live in a world that is constantly changing and evolving. And to face global challenges, we need people with dynamic personalities. At Srishi University, Odisha, the next generation of decision makers and leaders are groomed with a purpose to learn, lead, and serve. It is emerging as a center of premium education in India, blending the best of East and West. This university has a unique approach to education that combines Western innovation with the ancient values and wisdom from the East. It is one of India's first alcohol, drug and smoke-free campus. Spread across 187 acres of land and located on a hilltop on the banks of the Mahanadi River, the sprawling and beautiful campus is inspired by the ancient universities of Nalanda and Takshashila. Thousands of students from across the 28 states of India and several countries of the world call Srishi University their home.
If I had to point out that one thing that really makes me feel special about studying in SSU, it would be that synergy between the students, and that I think is the most special thing.
I'm sure that these students will make decisions in the near future that will change the world for the better.
I'm really happy to be here, and with every day I understand more how I appreciate this time.
Srishi University offers courses from an undergrad to a master's level and also PhDs. Srishi University is one of the first university in all of Asia to introduce osteopathy, a drug-free, non-invasive manual therapy that aims to bring a revolution in the path of medical science. Yoga, meditation and spiritual values are the foundations on which the university stands tall, and it is these that are shaping the personalities of our students inside out.
You know, there is no ragging happening, there is no one picking on each other, and that is really important, I feel. The environment of the university is such that the emotional quotient automatically develops in a person.
This is my 4th year in SSU, and I have seen a transformation on a very large scale in my life.
It gives you more than it promises, so that's all a person can ask for.
Sports is a way of life at Srishi University and is clearly exhibited in this vibrant campus and its students. The annual Fest Orion is a pursuit for brilliance. It is envisioned to be the biggest social celebration in Odisha and Eastern India, with the ambition of becoming the best annual fest in the world. Our alumni have been placed in some of the top multinationals, while some have set forth to create successful startups of their own.
Srishi University was one place I looked at where
I feel I could learn more than just what's in the books, because at the end of the day I realized it's a lot about handling people more than systems. It's about actually coming together and making a difference, and you don't find that so easily.
In 2018, Srishi University was awarded the Best Bootcamp Startup Award by the Government of Odisha. Right from its year of inception, Srishi University has been recognized with several other such awards. Our vision is to impart holistic and value-integrated education in order to develop visionary thinkers and leaders. The revolution in education has begun.